Hey you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before starting on our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, courses, videos, and review books to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with a 99% pass rate on our comprehensive exams and courses, as well as 100% pass rate on our one-on-one courses. Now, disclaimer is just a reminder, we know there's no absolutes in medicine. We treat on a patient by patient basis. And I just like to say that I create these questions based on the guidelines that are on the exams of the ANCC and AAMP. Now, if I am doing videos or teaching on things that we currently do in practice, I will say that so there's no confusion. Okay. So, with that being said, let's get into question number one for today. The nurse practitioner has diagnosed the patient with sinusitis today. She is planning her treatment. What is the best treatment for this patient? Is it A, flagyl, B, augmentin, C, doxycycline, or D, levofloxacin? Take a moment, tell me what you got in the comments. All right, you guys. I always recommend reading the stem of the question first, so that allows you to slow down and ensure that you're answering what is truly being asked in the question. So, the stem of the question states, what is the best treatment for this patient? All right, so what does the patient have going on? We got to run it back, right? So, the patient has been diagnosed with sinusitis. So, how do we treat sinusitis? So, you should think first, because it's not telling us any allergies or anything in this scenario. So, your best answer is B, augmentin. Now, just a little sidebar. We treat sinusitis typically with augmentin. If they have a penicillin allergy, then we will go with doxycycline. Typically, when in doubt, if they have an allergy to another antibiotic, we go doxy. So if you're struggling, try that if that's an option. But here, again, if allergic to penicillin, we're going to go with doxycycline, okay? That's the first step. Now, if you have exhausted the augmentin and the patient is still having persistent symptoms with the sinusitis, um, fever, etc., then you're going to go to a fluoroquinolone, okay? So if they're allergic, go doxy. If the medication, the augmentin, has been exhausted and they're still having persistent symptoms, go to a fluoroquinolone, okay? All right, question number two. An African American male presents to the office today for follow up. He has a history of COPD, gout, and seasonal allergies. His vitals today are a blood pressure of 149/70, pulse of 80 beats per minute, temp of 98.6, and respirations of 20. Based on these findings, how should the nurse practitioner treat? Is it A, chlorothalidone, B, amlodipine, C, lisinopril, or D, losartan? Tell me what you got. Tell me what you got. All right, you guys. So, stem of the question states, based on these findings, how should the nurse practitioner treat? If we're treating, we run it back and see what diagnosis we have, right? So, if we don't have a diagnosis already provided, we have to look at our assessment so we can figure out the diagnosis. So, this patient, African American male, has come into the office just for follow up. He has a history of COPD, gout, and seasonal allergies. Vital signs are pretty much stable, other than that blood pressure. Systolic is elevated, so we need to give him some blood pressure management. Now we know that first line therapy, we have our thiazides, we can do ACEs, ARBs, all the things, calcium channel blockers, all of the things, right? But one, in African American patients, the best medications are either thiazides or calcium channel blockers. He's not diabetic, doesn't have chronic kidney disease, so we don't need to go to an ACE or ARB initially. So we can eliminate C and D. Now, typically thiazides are our initial thing that we go to, but here it states the patient has a history of gout. And remember that with thiazides, gout is one of those things that are one of our contraindications. So here you want to go with B, amlodipine, a calcium channel blocker, because with African American patients, we think thiazides, calcium channel blockers. If we can't do the thiazide, next up is the calcium channel blocker, okay? That makes sense? And I think everybody gets confused with blood pressure management because there's so many options of first line therapy, but group it together. If there's nothing going on, everybody can go straight thiazide first. If they have diabetes, chronic kidney disease, we can go with an ACE or an ARB. Always think of the contraindications and allergies that would eliminate any of those options. And African American patients also respond well to calcium channel blockers. So that's another option to put in place. So just kind of think of it in those segments so it's less confusing. All right, and lastly, the nurse practitioner and NP student are discussing A1C levels. A patient in the office today has an A1C of 6.3, and the NP student is inquiring if this warrants any further management as it is normal. What is the best response by the nurse practitioner? A, no, just explain the results to the patient. B, yes, this is considered pre-diabetic and the patient needs to start lifestyle modifications. C, yes, this is type 2 diabetes and we need to start metformin. Or D, repeat the A1C. What do you think? Tell me in the comments. All right, you guys. So, some of the question states, what is the best response by the nurse practitioner? So, they're talking A1C, nurse practitioner, NP student, right? This patient has an A1C of 6.3, and the NP student is like, that's normal. Do we need to do anything further? So, what would you do in this situation? Would you go A, no, just explain the results? No. B, yes, this is considered pre-diabetic and the patient needs to start lifestyle modification? Yes, that's your answer, right? Because up to 6.4 of A1C is considered pre-diabetic, and that's one of the higher normals at that, of that pre-diabetic range. So we want to start to incorporate those lifestyle modifications, trying to prevent them from exceeding that 6.5 and needing to go to the next steps, the metformin, et cetera, right? So you want to tell them on the low carb diets, making sure they exercise 5 days a week for at least 30 minutes each of those days. If it's high intensity exercises, doing it for 75 minutes for the week, right? All right, you guys. So I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure y'all meet me back here. If you need any of our resources to assist you as you're preparing for boards, if you're struggling and you're preparing to retest, we have review books, ebook options, or paperback, both linked in the bio of this channel, as well as the website is linked there as well. Um, we offer self-paced courses. Our 5-week courses enrollment is open. Y'all have been lining up for those. So we have a few more spaces available. That class starts on June the 10th. And then if you want a one-on-one session, those are available as well, commonly utilized to assist with taking you from unsuccessful to successful, and strategizing based off of where you currently are and coming up with a plan and working alongside with you to help you get to that successful rate. So just let us know. Give us a call at 803 400 6864. Y'all, I can't talk this morning. 803 400 6864. You can shoot a text message here as well, or shoot us an email at thenursingstudio, the number one, at gmail.com. And if you just simply don't know and are just looking for guidance or advice on which steps to take, you can also just reach out to us. We're happy to assist you. But as always, meet me back here. Happy studying. Bye, y'all.